so we can start and stop as we go along. So Mohsen, we've just finished our fourth Dubai Urogynecology course. I thought it went particularly well, and we're hoping to make some changes for next year.
Yes, I'm very pleased with the result of this course. As you said, it went very well. I think the delegates were extremely happy to understand more and learn about urogynecology. But as you rightly said, we still need to change the course and modify it to even make it better.
We've discussed making an extra day for the course next year, doing a certificate in urodynamics. Part of our course this time included basic urodynamics, but I think we both feel that we can do a more advanced urodynamics course which would equip the delegates to actually undertake the test themselves, interpret the results, and perhaps offer a service to their local colleagues and expand their professional expertise.
I think this is true because for anybody who wants to treat and manage urogynecology patients, they will not be able to do that satisfactorily without doing urodynamics investigations. And that's why, for a start, doctors who practice urogynecology or provide service of urogynecology to women have to understand and be able to do urodynamics. So hopefully the certificate in urodynamics will enable them to do that.
I was particularly happy to have some urodynamic equipment available for this course from Laborie and allow the delegates to observe how to put the equipment together, how to do cystometry, how to do a urethral pressure profile. I think they enjoyed that particular aspect of this course.
Having the machine and teaching people how to use the machine is a very important step, so they become familiar with it. However, this is in itself is not enough. We obviously have to be able to interpret the trace and be able to make a proper and accurate definitive diagnosis so they are able to manage and treat these patients properly. And that's why, as a package, the certificate in urodynamics is going to provide them with all these skills and really enable them to provide a good service.
This time, our delegates particularly enjoyed having the practical stations where they could use pelvic trainers to learn how to do TVTO, retropubic TVT, also sacral spinous fixation. I think this is something that we need to expand upon for the next course as well.
Yes, we started the hands-on workshops by teaching them simple stuff, such as how to insert pessaries, different types of pessaries, recognize different types, and the indications for the use of each type of pessary. And after this, we started, as you rightly say, teaching them to do tapes and sacrospinous fixation. Some of them, I'm sure, will be able to do these procedures. Others may not be able to do procedures themselves, but at least they will understand about the procedures. They will understand who are the patients who will need such a procedure, so they're able to refer them. And we have to remember, Simon, as you and I know very well, that majority of urogynecology patients and women with urogynecological problems, pelvic floor dysfunction such as incontinence and prolapse, are managed conservatively, either with physiotherapy, with drugs, and not all of them require surgery. Only perhaps a small group requires surgery. And that's why the course will make them able to manage a great deal and a great number of patients before they refer them further to a subspecialist.
Yes. Part one of the course is entirely devoted to ensuring that the delegates understand about basic anatomy, physiology, can undertake simple investigations which are of vital importance for the majority of urogynecology patients, but also to do pelvic floor assessment and learning how to fit the variety of pessaries which now exist. I think the part two course, because many of our delegates have varying levels of skills and expertise, needs to cover the simpler aspects of surgical intervention, but lead right through to the more complex operations such as sacrocolpopexy and sacrospinous fixation, all of which this time we were able to demonstrate using videos as well as the practical aspects.
And I think, as you said, when the course changes and evolves next time, we hope to include other interventions, other procedures, such as injectables into the urethra, such as the injection of Botox into the bladder for intractable overactive bladder. So in the future, other hands-on training will be included, which I think will be extremely useful to the delegates.
I think it would be fantastic if we could organise a wet laboratory to have some hands-on using animal bladders to teach delegates how to undertake periurethral injections of Bulkamid or macroplastique, but also perhaps even to show them the techniques of how to inject intravesical Botox.
That would be extremely useful and interesting, I'm sure, to them. But let us also stress that the course is not only about science and urogynecological topics. We also talk about things like governance and consent and medical ethics, which makes a good doctor is an all-round doctor, and a good doctor doesn't only provide high quality service, but also have to have good communication and apply good ethical medical issues. And that's why we teach and discuss all this. And there is also, Simon, the fun bit of the course, having quizzes and clinical scenarios.
That's true. That's true.
So I really think it's a good, we're satisfied, it's an excellent course, and we need more people to come. The course will be not suitable only for people who want to specialize and provide urogynecology service at certain level, provide surgery, but also, as we said, for the generalists who need at least to have the skills of knowing and diagnosing cases before they refer them on to other specialists.